Good morning. We are so excited. This is I'm Wendy.
I'm Julie Schumacher.
And we have Dr. Rachel Schreiber here with us today for Ask the Expert. And cannot tell you how thrilled I am to have you here today.
You're so nice. Thank you.
So we're going to kind of just give a little information. We were with Power Up, and our roles in Power Up is to act as a liaison for families with kiddos with chronic medical needs and looking at their symptoms that their medical needs are presenting and help create strategies in the classroom to make it a successful day for these kiddos. And so looking at a little bit about allergies and looking at 1 in 13 of our kiddos have allergies. And so I'm going to start by reading Dr. Schreiber's bio because she's so amazing and I don't want to mess up any of her accolades. So I am going to look down and read, and then we're going to ask some questions. And you guys in Facebook world, if you want to chime in and ask some questions also, that would be fantastic. So with us, the lovely Rachel Schreiber. She is a diplomat of the American Board of Allergy and Immunology and immediate past president of the Greater Washington Allergy, Asthma, and Immunology Society. Dr. Schreiber is a Washington Magazine top doctor and a Washington Consumer Checkbook top doctor. She is named one of America's top physicians by Consumer Research Council of America and Castle Connolly. She has also been awarded the Super Doctor distinction. Of course she has. And Dr. Schreiber has published numerous articles in peer-reviewed scientific journals and co-author of allergic rhinitis and pediatrician.
Let me see it. What does it say? Otolaryngology.
Yes. See?
It's a big ENT textbook. Yeah.
Fancy.
Yeah.
And she is a member of numerous local and national medical and professional societies and served as a board member of the Pennsylvania Allergy and Asthma Association. And here she is at Dr. Rachel Schreiber Allergy here in Rockville. And so we're going to kind of get started and just ask you a few questions. Sure. And just see what you have to help us, help our kiddos out there, make it a good day. So our first question is, what is the difference between allergy and anaphylactic?
Okay, so actually I just want to mention one thing, Wendy, which is you said the statistic, which is 1 in 13 children has food allergy. And that's such a big number, right? Because that means that one child, at least probably in every classroom, there's a child with food allergy.
Right.
So it's a really big statistic. In terms of what is the difference, so anaphylaxis is sort of on the continuum of allergy. So if you have allergy to a food, let's say, that's what we consider to be an abnormal response. Your body sort of responds abnormally to that food protein.
Okay.
An anaphylactic reaction is a severe form of that, where your body can actually go into shock. So you can have multiple organ systems involved. It could affect your respiratory system, it could affect your skin, it could affect your GI system, it could affect your cardiovascular system, your heart, and ultimately it can lead to a fatal reaction. So that is what is so scary about food allergy, is that you have a seemingly innocuous protein that can cause a life-threatening reaction, and you don't always know when you're eating it. Right? If it's a really tiny amount in a food, it could be hidden. You may not taste it, and that could cause a severe allergic reaction.
And I really like how you kind of put that home in terms of a minimum of 1, possibly more students within a classroom.
Yeah.
So it really shows the severity and the need for intention to this conversation and to understanding what that individual student's needs are.
Right.
Because as you mentioned, that they may be consuming just a little bit of it, or not even being aware that they're eating something, whether it's in the cafeteria or something that's brought into a classroom for a party event, and then to have a plan in place to support that student.
Exactly.
So what is the difference between a food allergy and a food intolerance then?
So that is actually, there's a spectrum of food allergy. So on one end of the spectrum, we have what we call IgE, mediated food allergy. And that's when you can have a severe allergic reaction to the food that I just discussed, that kind of reaction. And on the other hand, you can have food protein intolerances, which can make it difficult for you to digest a food or can give you side effects, but it's not necessarily going to cause a severe reaction. For example, you could have a lactose intolerance, right? That's a difficulty tolerating milk, a certain enzyme, a certain sugar in the milk protein. But that's not going to cause a severe reaction. but it could make you very uncomfortable. As another example, gluten intolerance can cause other kinds of significant physical findings, and that's on the intolerance spectrum. But the anaphylaxis is considered to be an acute, severe, potentially life-threatening reaction.
Now, do you feel intolerance is growing? It's getting more, or we're just more aware of it?
I
and know
think,
what to do?
that's a hard question to answer. I think allergy is definitely growing. I think probably intolerance is as well. And there is more awareness about, I think, allergies and intolerance, both of them. Yeah.
So if my child is at a nut-free table,
Yeah.
right, at school, and feels
Right.
so isolated,
Yeah.
what can be done about that?
Yeah. That is such a big problem, because what we really want for these kids is safety and inclusion. And I talk about this all the time with parents, right? You want your kid to be social. You want them to be included. I've spoken with a lot of schools, and it's interesting because sometimes, a lot of the schools have a nut-free table and the kids may not sit at it because they really don't want to be isolated.
Right.
So one of the things I always talk about is what we really, really, really want to avoid is ingestion. Now, if I have peanut allergy and you eat a peanut butter sandwich and you have peanut butter on your mouth and you give me a kiss, will I get highs on my cheek? Yes. Will I go into anaphylaxis? Unlikely. I really have to ingest the food. And so that's a really important thing to remember as the kids get older and their hands aren't everywhere. It's easier to sort of control what I put into my mouth.
Right.
But I really try, with the peanut-free table, sometimes the children will have like one friend come sit with them, and so at least they have one friend there. And then, a lot of the schools in our area in Montgomery County, actually, there is not peanut in the cafeteria food.
Right.
And so that's also something to remember. If the kids are getting cafeteria food, maybe the peanut allergic child could sit at that table.
Okay.
And not sharing food is always something that they're trying
Not
to do.
okay. So
Yes.
thank you so much for saying that. So that is one of the things I always tell my patients is teach your children from such a young age, a very young age, do not share food. Your food is your food. Your friend's food is your friend's food. Don't share food.
Right.
Just decline politely.
Right. And they're trying to enforce that all the time.
Yeah. Just don't share food. Yeah.
No sharing.
Right. That's right.
Only
Share
at
everywhere else.
only
That's
at
right.
the lunch table.
That's
no
right.
sharing.
That's right. That's right. Yeah.
So in the event that we need to let classmates and teachers or just out in public know that there's a potential situation, life-threatening, are there any kid fashionable alert bands that my kid could wear?
There are.
Willing
There
to
are
wear?
a couple. Julie has some here. So these are the, this is medid.com, and you can see a lot of the kids wear these kinds of silicone bracelets.
Which they look like the other
Yeah.
fun bracelets that
Right.
people
Exactly.
have. Right.
So those are really easy. And, but a lot of times, even if you just search the web, you will find other kinds of fun bracelets to pick up. But I think these silicone ones are nice and easy for the kids to use.
Right. And that's what I would say. So it doesn't make them feel like they're standing out, probably, that they feel like their band looks like every other band,
Exactly.
but then it gives the important information in the event that there's an emergency.
Exactly. And there's another thing that I want to tell you about. It's, hold on 2 seconds. Can you just leave that there? Okay. Sorry, I have someone at my door. Of course. Okay. I have one other thing to show you. So we have these cards. I really like these, Wendy. These are, this is called Select Wisely. I don't know if you can see it on the screen. But these are for travel, and these are when families travel overseas. You can buy these cards, and they will translate what your allergies are in whatever language for the country that you're going to. And they are pictures, and they'll translate it, and I think this is a really nice thing to be able to travel with, because in other countries, I think there is definitely not as much awareness. So it's nice to have something else in your back pocket to pull out at a restaurant and say, here it is in your language.
Well, and I love that you can just carry that, and just even anywhere here in the States, if there's, there's just always something really easy to hand over, and then it's very clear of what the allergies are, and then sometimes then that server can take it back to the kitchen and show the kitchen. Because sometimes it gets lost in translation between the server and the kitchen as to what.
So it's good in English too.
Yes.
Yeah,
yes.
for sure.
100%.
Yeah.
So this is a big question, and it's even a big question in personally speaking, I have a son that is allergic to bees, and so, and this EpiPen and where to get them, and there was a shortage of them for a while, and so can I use an EpiPen with a past expiration date?
Okay, so first of all, we always tell our allergic kids, no matter what you're allergic to, the treatment is epinephrine. So you always carry 2 EpiPens, okay? So that's the first thing. And you always carry 2 in case one malfunctions, you have a second dose, or in case you need a second dose, it can be redosed in 10 minutes.
Thank you for saying that,
Yeah.
because that has been a question that just even has come up in conversations that I've heard before, and so
Yeah.
that's really good information for parents to know and for
Yes.
kids to know that to carry both
To
pens
always carry 2.
for that reason.
Exactly. Now, if an expired EpiPen was the only thing that you had, you would use it. Here's the problem. So they've actually studied this, and the EpiPens that are expired are good for like probably 5 to 7 years after. Even at 10 years after, they had like 60 to 70% potency. The problem is when the manufacturer writes it on the pen, you know, we're sort of all like, what are we supposed to do? I have to give you a new EpiPen. Now, in the case of a shortage, I would say if it really is all you had, that's what you're going to use. And I wouldn't even, within a year, I probably would say, just use it. You know what I mean? So it's not that if it expires, it is bad in any way. It could lose potency over several years' time.
And do you have any ideas that you've heard from parents or from yourself, just in terms of fun ways to carry them as kids get older? You know,
It's
they
hard,
may not
you
want
know.
to be carrying something as large as the EpiPen.
So this is a challenge that we work with all the time. You know, especially our highest risk group, believe it or not, is our 16 to 24-year-olds. That's I'm a teenager, I'm invincible, I don't need to carry my EpiPen, but these are the kids, you know, my kids who are going off to college, I try to pound it into their heads, like you must carry it with you all the time because this is a risky behavior time, right? And so those kids really need to carry
dining halls
it.
are very tough.
Dining halls are tough,
They're
parties are
different than the
tough.
home kitchen, right? Yeah.
Right, they completely are. And so, you know, I always say just put it in your backpack, carry it in your backpack, you know, at least do that. We have different there are sort of different devices on the market now.
Okay.
So there's the typical EpiPen, which you've probably seen. And there is actually a generic form of this as well, which is slightly different,
Okay.
which is just as good and should be, you know, if that's what the pharmacy gives you, that's totally fine. You just have to know how to use your devices. And there's this device as well. It's called the AviQ, which is a newer device, and it's actually a really nice shape, and it actually talks to you. You know, the issue with all these drugs, one of the issues, is the cost involved. And so,
Right.
for example, this drug is $4,500 for a 2-pack. So it can be prohibitively expensive. On the other hand, as we were talking about before, for a college-aged boy or a high school-aged boy, this is like a nicer, actually even for a girl, it's a nicer shape to carry around, right? You can fit this in your pocket easier than you can fit this kind of device in your pocket.
Well said.
Thank you.
So how then, kind of on this trend, how can I eat out at a restaurant safely with peanut, sesame, or tree nut allergies?
It's hard. I can't sugarcoat that, you know? It is so hard because mistakes happen all the time. And I've had patients come into my office and they said, we checked with the kitchen, we checked with the waiter, we checked with the manager, they all assured us, and then, you know, someone had a reaction.
Right, contamination.
Contamination.
Right.
Yeah.
Someone doesn't change the gloves, or they put it on an area that in the kitchen that had something before that they didn't know.
Right.
It's really tough.
It's really, really difficult.
I think restaurants are trying really hard now.
Yeah.
When restaurants have someone who comes over and actually will talk to the family and find out what it is and take notes,
Yeah.
you know they're really taking it seriously,
Yeah.
and it makes you a little bit more comfortable.
Right.
But
The other thing besides restaurants is actually, believe it or not, most accidents happen at home. So
Really?
yes. So this is like, you know, one child has, let's say, cow's milk allergy, and the other child doesn't. And so you have almond milk for one child and cow's milk for another. And by accident, dad grabs the wrong one. Right? I made it dad. I made it dad. Why did I do that?
That's
Right, okay. But we see that all the time, and in all honesty. Or you have different kinds of granola bars in the house. And
Which is easy to do if you're in a hurry,
so,
right?
It's so
grab
easy to do.
one and-
Every time you know, it's a quick thing that you do. That's why we call it an accident.
Right.
Yeah.
It's an accident.
I could see that easily
Yeah.
happening.
Yeah.
Absolutely.
Yeah.
So if you're with a child who is having trouble breathing due to an obvious food allergy, what is the best practice to take?
You're just going to give epi. That is your best practice.
Right
You
away.
give epi and call 911.
So you give one dose, call 911.
Yep,
Okay.
exactly.
And then they'll walk you through the rest.
Yeah, so if you're looking at a kid and you're like, this kid doesn't look right to me, you could always call 911 and they will walk you through it.
Okay.
Okay, it's actually, the devices are very easy to use. And hopefully if you're taking care of a child who's not your child, that parent or guardian has given you instructions on how to use the device properly. But you're never going to be wrong to use epi, and that's the important thing to remember. You are always better off using it, and most of the cases in the literature of patients who have had near fatal or fatal reactions, almost always it's due to a delay in epinephrine. So epinephrine early is better, and you're
Okay.
not going to be wrong. So it's scary because it's an injection. I always say if it was like, you know, a little sublingual tablet that you put under your tongue, it would be so easy,
So
right?
quick, right? You would
Yeah.
just do that.
But actually they are working on a nasal spray right now, so epi could be delivered intranasally. So there are other delivery forms that are being worked on. But epi and 911.
So helpful. I mean, really, it really is. I can't, you know, just knowing that, doing it,
Yeah,
applying it, or
using it.
using it
Yeah,
Right.
is not going to be hurtful.
exactly.
And knowing what to do when it happens, because you have kids all the time over at your house for play dates or
Right.
whatnot. Sometimes they try new foods, and you find out these
Right.
things,
Right,
and it's something you didn't know.
right.
So knowing what to do in an emergency situation is a lot of
Yeah,
preventing.
yes.
Remember
Knowing what to
life.
do is half the battle,
Right.
right?
That's
Then
right.
you've got to do it.
Then you gotta do
it. Yeah.
So, what are the
That's
treatment
right.
options for
Inside,
peanut
sorry.
tree nut? What are the treatment options?
Okay, treatment options. So
For
the
peanut,
standard,
tree nut,
yes. Okay,
and
so
sesame allergies.
the standard of care is avoidance. That is the standard of care. However, what is on the horizon and what we're actually doing in our office now is something called oral immunotherapy. For short, we call that OIT. We are actually taking kids and including highly allergic kids who are highly allergic to peanuts, tree nuts, and sesame, and we are desensitizing them to those foods by giving them tiny increments of the food over time so their body develops a tolerance. It's not a cure, but you can develop tolerance to the food so that when you're out and about and you have an accidental exposure, you're okay. It's an amazing therapy.
That is really amazing.
It is, and we have been doing it in our office for about 2 years now, close to 2 years, and it is honestly one of the most rewarding things that I've done in medicine. It's incredible because it really has the power to change people's lives.
I bet. And
yeah.
so, what are your patients coming back and reporting?
So it's really
Have
interesting.
they had any accidents that they can then come back and say?
Yeah, so I had a 4-year-old girl who had peanut allergy, and she was eating 4 peanut M&Ms a day. That's what her dose was. And one night, her mom called me at about 6 p.m. on a Friday night, and she said, oh my gosh, my husband, it was her husband, just gave her another 4 peanut M&Ms. He misheard me. He thought I said, I didn't dose her today, but I said I dosed her today. Okay? And so he gave her another 4 peanut M&Ms.
So basically double.
So it's a double dose. And so she said, should I give her epi? And I said, well, what does she look like? And she said, actually, she looks fine. So I said, so no. And that was a total example of having this
Right.
accidental exposure and
Right.
also having protection and being
Right.
okay.
Right.
Yeah.
And what a comfort for the
fascinating.
Yeah.
mom, for
Yeah.
the parents to
Yeah.
know that by going through this process, hopefully
Right.
it will eliminate scarier situations down
So-
the road.
And that's what a lot of the parents talk to me
Right.
about. They say, I can send my child to a birthday party and not be so afraid.
Right.
And so they say that's why it's really
Oh,
helped
no,
us
that's
so much.
amazing.
Yeah.
It's amazing.
I mean, of course, with anything, there are side effects. So, when patients come in, I really counsel them the good and the bad, right?
Right.
There's warts with everything. So we go over everything so patients really understand sort of what they're getting into.
It's a trade-off. Everything's a
Everything in
trade-off.
medicine is a trade-off.
It's
Yeah.
a trade-off.
Yeah. Yeah.
But if this type of therapy works so that, high-risk patients can
Yes.
actually go out and eat in a restaurant and they can take that
Right.
risk and enjoy themselves and normalize
That's right.
Right.
what's been there in this type of a therapy,
Yeah.
it may be worth it
Right.
it may be worth the trade-off for some people.
Exactly.
Right.
Yeah.
Well, we don't have any more questions. Do you have anything you would like to add?
No, I think just thank you so much for having me.
Absolutely.
Food allergy is so important, and it's unfortunately, the numbers have increased over time in the past couple of decades. And the recommendations are changing over time as well. So we used to say, don't introduce highly allergenic foods to babies, and now we're saying, do it, introduce it, because during the time when we were saying avoid, the food allergy rates continue to rise.
Right.
So we are introducing foods such as peanuts, tree nuts, eggs, milk at very young ages now.
So a lot of what we do with Power Up is doing that liaison position and having that conversation with medical professionals and school educators and helping to bridge that gap. So as a medical person, what do you encourage parents to do as they are trying to advocate for their child that does have an allergy at school?
So most of the schools, the schools are very familiar with food allergy
Right.
at this point, thankfully. And so a lot of the times the parents will either meet with the principal or meet with the nurse and find out what kind of measures are in place for that particular school, because it can vary by school. And then just making sure, speaking with the teacher, just advocating for your child in such a way that the parents in the classroom know, the teacher knows, that everyone sort of knows that your child cannot eat this certain food, because kids bring food into the classroom all the time. And so that's where we, parties, we really worry about Halloween, Valentine's Day.
Right.
These are typical events, and for most kids they're really fun, and then for some kids they can be very dangerous. And so just trying to get the word out about your child having food allergy, and not to be afraid to do that, because
Yeah.
this is like the
So
stakes,
we're doing,
right?
so
I
we're
know.
doing,
I know.
We're
You
having
guys
a
are awesome.
conversation.
We love
And
it.
every single, not to interrupt, every single kid who has an allergy, it's
Yeah.
great to talk to the physician,
Yeah.
and because they understand that child, and not every kid with a food allergy is the same in the classroom.
100%.
So there, you talked very early on about that continuum and that
Mhm.
spectrum from anaphylaxis to, maybe the intolerance to some
Right.
foods, and it covers a lot of different areas. So
Right.
some of the kids that, it can induce anxiety, it can make it very
Oh.
hard for them
It can.
in a school setting every time they go to lunch.
Right.
And we've got to have that conversation so we can make it a good day for
Right.
kids, and they can go and they can feel, comfortable
Yeah.
and do what they can do with what's
To be a
right
kid.
for them.
Right.
To be a kid.
Totally. That's
Exactly.
what we want.
Well, it's
Yeah.
quite a pleasure,
Thank
Dr.
you.
Schreiber here at Schreiber Allergy in Rockville. So thank you so much.
Thank you so
For your
much.
time.
So nice.
Thank
Thank
you.
you.
Thank you.